Good evening. It is, wow, that's loud. Cunningham Township Board meeting. Will the clerk please call the roll?
Ms. Wu,
Here.
Mr. Evans,
Here.
Ms. Hersey,
Here.
Ms. Colasetti,
Here.
Ms. Bishop,
Here.
Ms. Wilkin, Mr. Quisenberry,
Here.
Mayor Marlin, Ms.
Here.
Chenoweth,
Present. I think Diane said here too. I think I heard her. Okay.
Mr. Williams.
Yes, that was a year.
Okay, we're good.
All right, first item on the agenda is approval of the minutes from July 11th, 2022. Can I have a motion?
So moved.
Second.
Moved by Chandra, seconded by Sharice. Any corrections? All those in favor, please say aye.
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 All those opposed? All right, are there any additions to the agenda tonight?
Nope.
No? All right. Well, it is time for public participation. However, there is nobody in the audience, so I think we can move on since there's nobody here. Next item is committee to verify the bills for the town fund and the general assistance fund. Danielle?
Thank you. Good evening. So in the town fund, we had $66,482.78 in expenditures this last month, and in the general assistance fund, we had $100,745.63. That brings us to total expenditures of $167,228.41. The details of expenditures are in your packet, and I'm happy to answer any questions you have.
Questions for Danielle? Okay, can I have a motion to approve the bills?
Second.
Moved by James, seconded by Sharice. Is this a roll call or is this a voice? Okay, all those in favor, please say aye.
Aye.
All those opposed? All right, reports of officers.
I just want to point out a couple of things from the supervisor's memo, if you want to pull that up. So we had a self-care fair, what was this, last 2 Sundays ago? It was July 31st, from 2 to 5. We had about 175 people attend, which is our largest self-care fair. I think there's a big need for self-care right now. Want to thank all of our partners. We had haircuts, we had lots of food, yoga, massage, dance, acupuncture, fresh vegetables that people could give away, and Raw Tools, which is an out-of-town group that was working on a series of events to basically have people donate or give back their guns, hand over their guns, and they disassembled the guns and made them into parts. And so at our event, they created this image that you see in the supervisor's memo that says "Grow Peace," and so it's made out of different pieces of gun parts, and it lives in our Come and Eat garden in Township. I also wanted to let folks know that we will have a back-to-school party on Sunday, so this coming Sunday, August 14th, in partnership with the Urbana School District, and that is from 2 to 5 p.m. at Cunningham Township. We are located right across from the library at 205 West Green Street, and there will be free backpacks, free school supplies, free haircuts, free pizza, lots of kids' activities, bubbles, clowns, lots of fun things for kids to celebrate going back to school. So if you have any kids in your life, please feel free to direct them. We are currently at about 72 participants in general assistance. The number of homeless participants remains low at 8. We're happy to see that. We have about 9 participants on our education and employment track. The rest are essentially on the disability and wellness track. And we've been kind of making progress slowly on our disability support. We continue to provide transportation assistance, so you can kind of see essentially where we're at in terms of we have 63 annual passes and 57 dash passes. We did have a big rental assistance month, so we're back up to 12 households. We provide up to 2 months of assistance. We are now at 108 households who have successfully moved into subsidized housing due to our advocacy. That has been about 2 years in, which is great. And many of those households are homeless households, so we're seeing the homeless numbers go down. I did want to point out, and it's been in your report in the past, but it was more of a pilot program. So essentially, we've had issues where, because we're moving so many homeless participants who are on general assistance into subsidized housing, there are times when, for various factors, they don't qualify for general assistance, but they still have income support needs. So it may be that they're not as interested in, engaging in the case management services, or it might be, there's certain requirements to be in the general assistance track. Or it might be there are substance abuse or mental health issues that we're working on in tandem. So we basically have launched a Housing First program. And what that does is it pays the housing costs for former GA participants who make no income and live in Urbana on subsidized housing. So if we didn't have this program, people we have moved into housing who are just paying maybe $75 to $80 a month in rent would be kicked out of the housing that they waited so long to get into because of other, usually healthcare related needs. So that program I wanted to point out because it's gotten large enough that it's kind of notable. It was kind of like a sidecar to the general assistance program. And it's now at 13 former GA participants who receive that Housing First. We do continue to meet with folks. It's basically as an on-demand case management services. So we keep folks in housing, we continue to engage and work on issues, but we don't have the same high bar of compliance, basically, as general assistance. So I just want to point that out, since you will see that in the town bills, and you'll see essentially it's always less than $100 a month that we're paying for those participants. Let's see, anything else I want to point out? We are currently looking at our street outreach numbers, so we're supporting 17 homeless individuals who are street homeless right now. Overall, we've supported about 50 since we started the program a year ago. And so essentially, what I'm doing, because we have a large enough data set, is we're doing some real analyses on who is not served through shelter. Obviously, there's folks who are not served even when we had low barrier shelter, and then there are folks who are not served currently. Who do not, folks who are not served currently. So essentially, I hope to have a report to the executive committee of the Continuum of Service Providers of the Homeless on what we're seeing, and I'll bring that same report to the town board. I think it would be interesting to look at. So, we are going to stop our hot breakfast for homeless residents. We're looking at a way. Essentially, it was a grant-funded program. We're running out of those dollars that were allocated to it, and I'm working on a different approach where instead of buying and heating, say like Costco breakfasts outside of the shelter and then delivering them each morning, we're looking to see how we can support the shelter and having those on site with the equipment they need. In terms of low barrier winter emergency shelter, I think this is also of note both for the public and for the town board. As you know, the low barrier winter emergency shelter that we help to resource and kind of provide some governance support for, it closed April 16th, 2022. City of Champaign Township has reported to the Continuum of Service Providers of the Homeless the following updates. So essentially, they've said that they will operate a low barrier shelter entitled Strides with a start date in November. They don't have a specific start date, but it will be in November. They are resourced from the city of Champaign to operate shelter for 2 years through October 2024, and they're seeking funds to remain open after that. The funds will come from GenOp funds from the city of Champaign. I think there's some shuffling. We thought it would be ARPA dollars, but it's GenOps. But essentially, that's where it's coming from. Community Foundation will act as their fiscal aid to receive private donations, so folks can give to that opportunity when that opens. The capacity is pretty great. It's 50 men and 10 women, so it's twice the size for men as we had in the low barrier shelter because we were pretty much running out of space every night this last winter. They're working on provisions for trans residents. There's not a lot of, that question came up, there wasn't a whole lot of information, but I expect that when they speak before the City of Champaign Council, they will give additional updates. It will be a 24/7, 365 shelter, so it's very different than the other model that we had opened. It's more expensive. I think it's also more trauma-informed in that way, that they're not kicking folks out first thing in the morning. There will be quiet times, but residents are not required to leave. There are not sobriety requirements, but drugs may not be used on the premises at all. And they're taking a harm reduction approach. They will have staff. The location is not yet disclosed, but they're working on a lease. And they'll be partnering in the homeless management information system, which was really important to many of the providers in the community, because it's actually been pretty hard to pinpoint and count and kind of analyze the data in terms of homelessness, because some providers participate in that system and some don't. And then the second area is with the street outreach documents or kind of analysis we're doing, we're really looking at how to meet the needs of survivors of sexual violence. We're seeing a lot of, like, when we look at the women who are not using the shelter, that tends to be a big picture. So even though the women's shelter is not full, we have plenty of women we're working with who could qualify, who don't go. So just trying to better understand that situation. We met with Up Center and some of the races staff, and we plan to meet with Courage Connection. I also met with Public Health on this last week. So I think housing case management, Urbana schools, right now it's not active, meaning this is the 2 weeks that there's nothing happening in the buildings. So our case manager is basically helping to move rental assistance cases because we're kind of backed up. This time of year, we are always backed up because, in my opinion, landlords clear poor people out to make room for students. That's what it looks like each year for us, is that it's really, really hard, and people also get behind on rent. So let's see. We have been able to divert most of our utility support to RPC because they had a new program that started with ARPA dollars, or with like COVID-related dollars. So you may have seen that we had a high number of requests for the last 6 months or so. It's been pretty intense, and you will see we had 0 helped last July. That's not because the need has gone down, it's because we've been able to refer people. So that's good. And let's see, I think the only other thing is we're taking a 2-week break on the Bucket Brigade. And we in some ways, that program has become a scarce resource in the community. And so we're really trying to, since we only have 20 buckets a week plus some hotel packs, trying to make sure that we're supporting folks who are limited mobility, and doing a much better job of supporting everyone who has food insecurity by providing comprehensive information about food access. So essentially, I'm going to have a specific person designated intern this fall who's just on food justice, who's helping to basically support a social work student who is supporting navigation around food justice, because we were seeing an increase in kind of requests and need. Let's see, I think that's it. I'm happy to answer any questions about our programs or the supervisor's memo.
Questions for Danielle? Chris?
Thank you for the presentation. I'm going to ask this question. I don't expect you to answer it. I just want to deposit it in your brain. But last week we were told by our community development department that they're setting aside $400,000 for what essentially is a shelter. And I just wondered if you had any advice on where that $400,000 should go. Should it go into a new building, constructing a new building, or in shelters that are already exist?
Well, so I think, continuous service providers, the homeless, and Cunningham Township, and we're on the executive board of that group, is actually doing a gap analysis right now. So we're essentially trying to answer the question, Chris, what are the specific gaps in our community? And the piece that Township, I think, really brings to the table that's somewhat unique is the street outreach data. And then we have good data on kind of like what the shelter system looks like, because HMIS was really tied with funding for low barrier shelter. We're also doing a street count. So we usually do a point in time count in January, coldest, one of the coldest nights of the year. It's kind of hard to find folks, especially if they're in parks and unsheltered. And so we're doing a count at the end of August. Our staff is assisting in that process. And what we're going to do is try to get a summer count in August. So that will also help with this. And in some ways, I think it's great for the taxing bodies to be setting aside monies in these pots. And I think I emailed you all about this. I would just encourage you to be very ready to be flexible, because it's like we could, or our partners could say, yes, we want to start a new shelter, let's buy something. But I don't know if you've seen the housing market. I mean, this is not a great time to purchase. And so a prudent organization might choose to rent for a period of time and then purchase. They might actually consider doing more of a voucher system and placing people in existing housing. I just think there's just a lot of unknowns because, for example, with us having a bricks and mortar shelter, there's some things that we have attempted to fix where the supply chain issues for, say, our locking system, which we do have locks, but we wanted electronic locks. Literally, it's been a 6-month process of waiting. And so I would just caution you and, staff and whatnot to just think about, we kind of have to be ready to, slice the pie in whatever ways are the best at that time. So in terms of shelter, what we are seeing is obviously low barrier shelter needs. Champaign looks like they're moving forward for 2 years, and there's a big question of what happens after that. They may have already come to Urbana to talk about funds. I'm not privy to those conversations. I'll be talking with Andy in a couple of weeks, so I don't have all the detailed updates. We ourselves are looking at the population that remains street homeless, that we have struggled to serve, and we're really looking at their specific needs. And so I would say, survivors of sexual assault and sexual abuse, where there's pretty significant trauma in their histories, and there's a huge amount of triggers and distrust, is a really important category of folks. There's also medically fragile men and women and trans folks, so across the board, but we see particularly a large number of medically fragile men. And so we have a shelter that, accommodates a small portion, but we've always had a long wait list for that. So medical fragility, disabled head of household. I have said this so many times, but essentially a disabled head of household are one of the least served populations in our community. So if you have a disability, you can oftentimes get into subsidized housing with seniors, but not if you have children. You cannot then get into that housing. So I would say survivors, disabled head of household, folks dealing with mental health and substance abuse issues, or as kind of supportive services, really wraparound services that are needed. And then what was the other one that I said? This is your pop quiz. I was summarizing. Okay, Chris, so you can watch the tape, but basically those are the four categories that I think, did I say medically fragile? Those are the categories that I think we need to look out for. And then the question is, who's going to do it, right? And really thinking about, what are the different providers and where is their expertise? And honestly, with some things like survivors, it needs to be a collaboration between all the folks who have expertise in that area. Same thing with substance abuse. There's a new program that Carl has with 4 new therapists to focus on substance abuse. I'm meeting with Carl about that specifically. So, how can we pull together the housing piece and the services piece to make it happen? With the goal, as I will say time and again, is to eliminate homelessness in this community, which is very doable. And especially with the ARPA dollars and the additional home dollars, it is very doable for us to get to 0 on homelessness. I don't know if that answers your question, but I think, it's evolving and we need to be, doing our research in this next 3 to 6 months.
Yeah, thank you.
Any other questions? Chandra?
Danielle, for the street outreach program, do they go into like encampments, sort of?
Yes,
and talk to
absolutely.
them?
We keep a list of every place that we know in Urbana, actually within Urbana and Champaign, so we serve the county. We go outside of Champaign and Urbana when requested, because frankly, there's just not as much kind of knowledge, or people tend to be closer to the urban centers for resources. But we keep a list of known locations of encampments, and we have basically a regular check-in. And we offer services, and we offer to help, we can direct people to the shelter, we can, help to refer them either to our own programs or other programs. And so absolutely. And anyone who is aware of a person who may be street homeless or unsheltered, like you see a car and it looks like the car is full of everyone's, like all of their, belongings, you do have an alternative to the police to call, and that is a social worker at Township. So that person, so you can call anytime and leave a voicemail, or you can call when we're open and talk to a person, and it's 384-4144. And so essentially, folks can request what is essentially a wellness check. We're not there to harass folks. We do a lot of like repeated contact before asking for anything. It's a very gentle approach to a person who may be in crisis to help to build trust, and if they consent to it, to engage them with any kind of support that they have. And we're very proud of that program, and it's been very successful in Urbana.
Thank you. That's very helpful. And you said 384-4144?
Yep, that's
Okay.
our number.
Thank you.
Yep, we always takes voicemail, we check it first thing in the morning, we'll call back. You can also direct people to come to Township. I mean, pretty much I direct people to Township everywhere I go, walking, biking, driving. If someone asks me for money, I say, hey, come talk to us. So, yep, I appreciate that.
Any other questions? Danielle, I had one question about your Housing First program.
Yep.
Is there a timeline? I know with GA and with other items, there's an amount of time that they're kept in that program, or is that just open-ended?
Actually, so general assistance does not have a max time. Essentially, there's a set of criteria, so you're either seeking work or you're seeking disability. If you stop participating in those two programs, then essentially, you get a warning, or usually 2 warnings. We make sure those warnings are delivered, and then folks' case is closed. So we give, people who, when their case is closed, they know it's coming. It's been well. In those situations where essentially someone is in subsidized housing, and we oftentimes know their income, we are able to, we're able to see the situation. What we do is we then recommend them at case closure meeting. They are recommended at the Housing First program. They have to consent to be in the program, and they have to agree to be in contact with our office, no less than, essentially when our case managers reach out, and we try to do that at least twice a year. So we basically do a light outreach, make sure that things are taken care of. And then we also have relationships with all the subsidized housing providers. So if someone is behind on rent at Housing Authority, and they will oftentimes call us to see if that person is somebody who would be eligible, like maybe they have been on general assistance before, or they need to be on general assistance. So what we're really trying to do is avoid evictions in public housing, because when that happens, it's like you won the lottery and then you lost the lottery, and it's oftentimes, it's very rarely because of willful non-compliance. It's oftentimes there's something else going on, and so we have an opportunity to kind of look into that situation, but they have a period of time where we're assessing, and they can still get their rent paid for. And we have had folks get off Housing First, right? So we'd have folks get on Housing First. Those things that is paid for. Obviously, their check goes from $325 to sometimes $75 that's paid directly to rent. So they have an incentive to engage, and then they'll come back on general assistance. So we feel like what used to happen is if we closed somebody's case, they would then pretty quickly go towards being an eviction court and so we really were like, we have to figure out some kind of bridge solution, so we have some time to kind of assess and work with folks on a different plan. So that's the program I'm pretty excited about. It's a very, very low budget program. And it's very low intensity case management, so I think it's a good approach for us at this point.
All right, I don't believe Wayne is on the phone to give us a report. All right, the next item is unfinished business. There is none. And finally, we have new business, which is ordinance number T 2022-08003, an ordinance approving the Cunningham Township annual budget for fiscal year 2022 revised. Danielle, do you want to say anything?
Yeah, so I sent you, so this was obviously in your packet. I also, just so you have some context, we were going to do a line item transfer, and we were working on the line item transfer, and we were about $10,000 over what allowed us to do line item transfers, which was not surprising because I actually thought we would have a new budget because of rental assistance this whole time. So essentially what we're asking you to do is, when, based on Illinois statutes, we're limited to the transfer of funds to an aggregate of 10% of line items within a given fund. So when the rule stipulates when transfers are over 10%, we must create and pass a revised budget. And it's through the same process as the regular budget, put on file, 30 days, public hearing, vote. So essentially, today what we're asking is to put this proposed revised fiscal year 22 Cunningham Township annual budget on file for public inspection. And the version I would like you to move of, it's basically the budget and the ordinance together, is the version that I sent you this afternoon, which is updated from what was in the packet. We've got basically the budget reflects our actual expenditures for this year, and we've essentially done an internal audit to make sure that our expenditures line up with the proper line items. So we're ready to close the books and hand our books over to the auditor. So this essentially would allow us to revise the budget. And I mentioned that the primary thing, and you can even see the numbers, we budgeted $85,000 for rental assistance. We spent $218,000. But we also budgeted $420,000 in general assistance and only spent $240,000. So we actually are under budget overall on the budget of the township as a whole. But we do need to do this revised budget to make up for that big kind of shift in expenditures.
All right, questions for Danielle? All right, do we need to? Sharice, did you have a question?
Yeah, is this the same as like just an amended budget from, okay, so.
Yep. So we're essentially amending the budget for last year to be the actual numbers that we spent. Because the budget that you passed a year ago, we had some line items where we had such large kind of overages and underage, especially with rental assistance and general assistance, that by state law, we have to essentially do an amended budget.
Okay,
Yep, and we have until the end of September to do that.
okay, thank you.
Sure.
Do we need to vote to put this on the budget, for the public for 30 days?
You don't have to, because it's not, you're not passing it at the moment, you just put it on file. Am I correct, Danielle?
I think, so I just did this at Public Health, and I'm pretty sure in my experience, every year we vote to put it on file. So I would say safest bet is that we should go ahead and vote to put it on file.
James?
Yeah, I would move to place this on file for 30 days so that we can act on it in September.
I'll second.
All right, moved by James, seconded by Chandra. Any discussion? It's a budget. Do we have to do a voice vote?
We'll do a roll call. How's
Okay,
that?
let's roll call vote, please.
Ms. Wu,
Yes.
Mr. Evans,
Yes.
Ms. Hersey,
Yes,
Ms. Colacetti,
Yes.
Ms. Bishop,
Yes.
Mr. Quisenberry.
Yes.
All right, that is on file for 30 days, and with no further business in front of the township, this meeting is adjourned. City Council will start at 7 p.m.
Thank you.